I'm going to do my best impersonation of the senator, but being myself, we have a lot going on in the community, and the senator will be here shortly. This is his podcast. Let's be clear. And our guests today are Dr. Michael Cookson, Dr. Delcasse Joseph.
Delcasse Joseph.
Yeah. We've been experiencing a lot of issues around men's health even before we had the pandemic. And so we're very pleased and honored to have two doctors here to discuss men's health. And to open it up, I'd say, what is the most important thing coming out of COVID-19 that we should be thinking about with men's health? And I'll start with you, Dr. Cookson.
Yeah, so I happen to focus on prostate cancer and that portion of men's health, but I would say that men were a little reluctant to come forward for routine health care in general before the pandemic, and coupled with the difficulties associated with the pandemic, there's been reluctance to come forward for routine health screenings, like for prostate cancer, like for colon cancer. And so it's time to come forward and get checked and make sure that you're doing your routine health checks, because cancer doesn't take a holiday. Cancer doesn't stop for a pandemic, and early detection is the key to either prevention or cure.
Thank you. Dr. Joseph, same question to you. I'm 58, I'll be 59 this year. What's the first thing I should take care of to make sure my health is at least going in the right direction, Dr. Joseph?
I think for the first thing, I always encourage a relationship with your general practitioner. The tendency is for us to treat the human being as a series of individual parts. And each expert or each specialist like myself and Dr. Cookson, we know our part, but it's always good to have a person that's in charge of the human being that can integrate the different aspects of us. So I think the first thing to do, something that we don't have as much anymore, is a relationship with a primary care physician that's able to coordinate different specialists to make sure that the data I may have done a rectal exam for colon cancer, and there is need for colon screening. But if I communicate this to a general practitioner and then he or she gets involved, a urologist or another specialist, that makes sure the care is integrated. So I think once you have that in place, the idea is trying to get all of your screening done. Prostate cancer, colon cancer being a major cause of death in our community. Certainly, we give that a lot of importance. Prostate cancer, heart disease, and a lot of other things like strokes. We don't have a screening method for strokes until generally. We depend on the general practitioners to really, really fine tune some of the medicine and blood pressure medication and so forth to prevent some of the general diseases.
Now, what do we do? I appreciate that, but as you're probably well aware, and particularly the African American community, one, we have a lot of men without any healthcare coverage, much less going to, and then those that have it probably don't go, like myself, as much as we should to see our primary physician. What do we do in those cases where someone doesn't have healthcare, they don't have a primary physician, which is, I would argue, probably the majority of people who we'll be dealing with? What do we do about those people when we're talking about men's health and just living a healthier life?
Well, the general aspect, medicine doesn't start with the doctor. I think medicine starts at home with what you put on the table. Low fat, balanced diet, the options in our community for different kind of foods that has less cholesterol, less salt, and there are even some relationship between your dietary contents and developing different kind of cancers. Certainly that starts with that, but it also starts with, if we're talking about health, aside from medicine, economic stability, job opportunity, and making sure the community has received the support it needs. Without those things, access to healthcare is very difficult. Access to health is very difficult. And what we're talking about really right here is access to healthcare for those men. Those men are informed oftentimes. But the difficulty in accessing the care that's available to them, or that should be available to them, that's a much more difficult problem.
And I would agree that, the healthy lifestyle part is a critical component to any longevity. And when you lead a healthy lifestyle and you eat right and you exercise regularly, that reduces the chance you'll have obesity, that reduces your risk of cardiovascular heart disease. And men come forward often only because of a symptom like erection problems, but that's possibly a manifestation of a bigger problem in their circulation or in their heart. So if we do see them and they come forward for seeking assistance, like with trouble with erections, we are trained to remember that they need to be seeing somebody for their regular care, or certainly we can order some testing looking at lipids and their cholesterol and that kind of thing. Navigating them through a healthcare system is an important part of it. And you touched on the access point. When we do our screenings, we follow up and we call them and we provide them with some tools in our community so they can access a regular physician and get those screenings and preventive care that they need.
And you're urologist?
I'm a urologist.
Urologist, and
yeah, so a plumber.
Could you tell us exactly what that type of medicine is, and when should somebody go see you? When would I go see you for treatment?
Yeah, so urologists are surgeons and surgical subspecialists that help men with problems related to their urinary tract, so difficulty urinating, erectile dysfunction, cancer screenings when it comes to prostate cancer, for example. If there's blood in the urine, that can be a symptom of an infection or a cancer in the urinary tract, which includes the bladder and the kidneys. Testicular cancer is the most common cancer in young men between the ages of 20 and 40. So if you notice an enlargement in your testicle, painless lump, that would be a reason to come forward. But in general, screening for prostate cancer, it's a blood test to start the process. It's a blood test that looks at a protein called PSA. So men between the ages of 50 and 69 are recommended. If you're African American, if your family has a history of breast cancer, colon cancer, prostate cancer, then you're recommended to get a baseline at around 45.
I am going to bring the senator into this conversation. He has just arrived. I'm letting him pull himself together, but we'll be joined momentarily by Senator Sanders. And remember, you're watching the podcast. Let's be clear.
Oh, there I go. I'm peeking in. Although Mr. Holland was a better Sanders than I could ever be, it's good to see you, Doctor. I heard some of it. I've heard, oh my God, do you have a whole library at your house or what?
That's just my Zoom virtual background. That is our library at the medical center.
Which medical center?
So I work at Oklahoma City at the University of Oklahoma and Stephenson Cancer Center.
So since our audience is primarily people of color, what men's health issue do you say that we should be worried about or concerned about?
Yeah, so number one, I treat prostate cancer. I'm an oncology urologist. So prostate cancer is the most common male cancer, and it's even more common in African-American men than in white men.
Why?
Why? That's a Nobel Prize question, which we don't have the answer for yet. It's probably a combination of genetics and environment, maybe responses to the male hormone at the receptor levels in the body, but we don't know exactly why it tends to be more aggressive and more common. But if I could make one bullet point for men to improve their health, it would be to get prostate cancer screening when they turn age 45 up until they're around age 70. That's usually a once a year or every other year blood test to determine if they need further investigation to see if they harbor prostate cancer, which can be lethal.
Well, let me bring in, we got other folk here. I think there's a Mr. Joseph here. Have you spoken yet, Mr. Joseph?
Plenty.
Well, I see you got an interesting background too. Who's that in the background, Mr. Joseph?
That's an Indian goddess named Pinga.
Oh my.
I like her for her universality. You see her, you find her in different cultures, popping and appearing with different names. So I figure it was up. I had no reason to take it down.
I like it. Who am I to argue? All of those things. All right, you got me peaked. My interest is peaked. Now, what do you bring to the table, Mr. Brother Joseph? What's your take on this men's health question?
Well, I'm a colorectal surgeon, and I've been practicing general surgery and colorectal surgery for almost 20 years. My take, and I've practiced in various environments, from Africa, Haiti, to the United States, even though my primary practice is in the United States. And because I've been to places where there is no healthcare system, I recognize the worst healthcare system we have in America may be actually better than most places. So the men's healthcare problem, I think, is threefold. One, it has to do with availability of adequate, advanced medical institutions within and near the communities of the men we're talking about, whether it be Black, white, but they have to be within and access to the community geographically. Secondly, they have to have the expertise on hand. You're likely not to find a Nobel laureate in some neighborhoods while the crowd up in Manhattan. They'd rather see 5 patients a day up in Manhattan than see 100 patients a day in Far Rockaway. So you don't have the expertise in these local neighborhoods. Third, access. Does a person that doesn't have a job, does a person that doesn't know how to manage a system, how does he get access to this healthcare system? So I do believe in America, you're going to find good doctors in the hospitals you go into. So there are the protocols there for screening. There are the protocols there for colorectal screening, and they're very well known. But those people in that community have to have access, availability of the facilities there for them. And that's a big problem sometimes. That's a big problem.
Well, you got, let's see, there's a push and a pull here. Why don't doctors both, why don't people come in to see you? What is the stigma, Dr. Cookson, and then Dr. Joseph?
Yeah. So what we find is that men usually only come forward if they're really bothered. And most of the things that bother men are below the belt. And so if a man comes forward and says, I'm having trouble with an erection, I'm having some sexual dysfunction, that is our opportunity to sort of snag them and say, yep, that's common. That happens. Don't be ashamed. We can help you with that. And by the way, you haven't had a regular health check in a long time or never. And this can be an early symptom of heart disease, hypertension, diabetes. You need to have some other assessments, and we're happy to deliver to you some help with the erectile dysfunction. But if we only focus on our one little area, back to Dr. Joseph's point, and we don't look at the whole person, we're going to miss that opportunity where they did engage in the healthcare system, and we might have an opportunity to save their life, even though their complaint was really just about erections.
Very interesting point. I learned from you. I didn't know there was a correlation.
Absolutely.
Well,
and then we take advantage of that and say, oh, we happen to notice you're at risk for prostate cancer, any relatives, any symptoms, take it one step further. So it really is it is a push and a pull, but if they've come to the table and are willing to complain about a symptom, we need to take opportunity to look at their whole picture. And we're not doing them a service if we just give them a couple of pills and pass them along on their way. So you got to use that opportunity to your advantage.
I see your point. Dr. Joseph, if I needed to come and see you, what would be my hesitations? What are the most common reasons given why a guy like me would not come to see you?
You just don't want to hear what I have to say.
That may be a very good reason.
I mean, oftentimes, as a doctor, you don't get a chance to play the patient role sometimes. Whenever I get to be a patient, I say, what is my doctor going to say? And sometimes what's in my head is, even as a physician, is far worse than the actual what the physician is going to say. So I think the more people interact with physicians, the more they see physicians as another member of the team, whether it be this specialist or that specialist, the more they get the sense we're going to have a conversation about it. And that conversation is going to make me better than I would have been if I didn't have that conversation. So I think, one, they have to prioritize their health. Say, that's the most important thing. Nobody can donate it to you. Nobody can improve it for you. And nobody can do that for you. They have to prioritize their health. And we have to prioritize their health too. Secondly, when they come to us, our interaction with them has to be reassuring. Very often, as a colorectal surgeon, they don't have cancer. We do anal rectal work. They may have a simple hemorrhoid. Reassuring them of what is the cause of the hemorrhoid, treating it for them, and being there to support them is all they may need, a fissure. Or they may have a wart, simple things, not even a cancer. Or that bleeding may be from something else. But I think it's important that we have conversation, reassure them so that their interaction with me as a colorectal surgeon is positive, but also that interaction reflects Dr. Cookson. So having had a good interaction with one physician, one healthcare practitioner, they're not gun shy about going to another. So I think that's part of the dynamics why people don't come in.
Well, Dr. Cookson, Dr. Joseph spoke of a good interaction with a physician. What does a physician need to bring to the table to have a good interaction with a patient, with a person?
Yeah, so there's a lot of work in our profession to try and help with that, but they have to be a good listener. They have to be a good communicator. And you also have to have some ways to sort of emotionally assess what these patients need. Some come with 2 family members or 3, some come alone. And I'm always worried about the ones that come alone because they may be reluctant in the first place. Some of them may have been sent by another doctor, but they haven't seen anybody. And you want them to come back. So one of the ways that we try to engage men in their healthcare is to get their significant others and their spouses involved in the conversation. And that usually allows us to see them again and again. So they'll come back for that test they need. They won't just disappear from the schedule. But we have to listen to them. They have to know that we're hearing their complaint, and we have to speak to them in plain English about what it is that we think's going on and why we're doing what we're doing to help them.
Well, doctors both, a report came out yesterday, and I'm trying to remember where, I think it's CDC, that the Center for Disease Control reported that people of color have just lost 2 years on their of their lives thanks to this COVID business. 2 years thanks to a combination of unemployment, homelessness, all of the stress and strains, and perhaps not seeing a doctor in this shutdown. How do we turn this around?
Well, one of the ways we can help turn this around is to vaccinate. And you know, and I know the politicization of that, but it's one of the first questions we ask anybody in our clinic. Have you had the vaccine? Do you want the vaccine? Make it available to them, because, you know, unfortunately, although many people can get sick and recover from it, it has killed so many thousand people in America. And we need to continue to be vigilant, because across America, probably less than half of all people who are eligible for a vaccine have received one. So again, you might come to me for a different complaint, but we need to know, you know, this lethal virus is out there, and it can get you and it can kill you. It's more devastating in people with undiagnosed medical problems. If you have blood pressure problems, if you have lung problems, if you have other immune deficiencies, this is going to kill you. So we need to get them vaccinated. And that would be an important message to send out for all people, not just for Men's Health Month.
Well, Dr. Joseph, you work at the epicenter. You are, with your luck, you are right at the epicenter of all of this COVID-19 business, which is coming into every other part of your operation. And with your luck, sir, the Rockaways has one of the lowest vaccination rates in the nation. We're the epicenter of it, and yet it's at the lowest. Has this interfered with your practice? Have you seen this in your practice, sir?
You know, one of the difficult things to do is to differentiate between a symptom and a disease. Most of the time in medicine, in our society, we deal with the symptom, the manifestations. And we deal with the manifestations so often that we forget the root cause.
Okay.
You know, it may well be true that life expectancy of Black men has decreased by 2 years. But how good was it before? And what path was it on? So using the numbers to then justify something that was already going doesn't make any sense. The vaccination problem you may find in the Rockaways stems from a lot of problems. It stems from historical distrust from the use of vaccinations throughout American history, the experimentation we see with vaccination in Africa, and the use that AstraZeneca is not even used in America, but is exported to all of the Black countries to be given to Black countries as a primary source of vaccination by America. So all of that, there's a true distrust there. And that distrust is not just Black. You'll find that distrust amongst the Jewish or white Black population who have seen themselves as victims in the past. Furthermore, I don't think compliance with anything was high in the Rockaways. Compliance with colon screening wasn't high in the Rockaways. Compliance with prostate screening wasn't high in the Rockaways. Compliance with coronary disease wasn't high in the Rockaways. And if you look at it across the board, it is a community medical infrastructure problem that manifests itself as a vaccination. Certainly, I want to say I'm vaccinated. I was confused whether or not I should vaccinate myself because I had COVID. I have antibodies. And I said, there's nothing wrong with me getting an extra dose of protection. I'm in the field, and I can't tell somebody to do it if I don't do it. Recognizing it's an emergency use act. But all of us are in this together. There's none of us that are immune as a society from this. But I think the low vaccination rate you see in the Rockaways is the new Madonna, is the new fashion statement. But compliance in general, to any screening, to any preemptive measures in the Rockaways, you find has been low. So I think there is an infrastructure medical problem to be dealt with. But certainly, as Dr. Cookson says, one place we can start because of its immediacy is definitely vaccination, and I would recommend somebody to have one because it is the best that medicine has to offer as to this problem of COVID-19.
Well, physicians, heal thyself and heal the community at the same time. Do you have this problem in Oklahoma, sir, or is this just a New York problem?
Not at all. It's a nationwide problem. And again, there are many reasons why there's people that are sort of vaccine hesitant or vaccine reluctant, but it's an education. And, when you work in the environments that we work through the whole time and, saw people dying in your hospitals in epidemic portions and, it's impactful. And most of us now, unfortunately, have family members, friends, relatives that died of this disease. So I really came on to talk about prostate cancer and talk about men's health in general, but since you brought it up and it is the pandemic, the most important thing people could do to ensure that they won't get sick themselves or pass it on to one of their loved ones is to get vaccinated. And then when the new rounds of vaccines come along, that'll be like a flu shot. You don't get a one and done. I mean, these things have to be repeated, and there's variants that will modify the way the vaccines are delivered. We have to be prepared and ready to continue to do that. So it is not a problem just in any one area of the country. It is everywhere. And there's a lot more stubborn people where I live than in New York. I trained in New York. I trained at Sloan Kettering and I lived in New York City. I love New York, but the problem is across the country.
Mm-hmm. Well, speaking of men's health, I'll give you a reason why men are reluctant. I don't know about you guys, but I find it embarrassing to go to doctors of your type, and I'm a little too conscious or too whatever, but I don't particularly want anybody touching me that I don't choose to. How do I get over this, gentlemen?
Well, a lot of the information can be gathered without touching you.
I like it.
So that's important to know. Then, it's also important to know that most of the things that below the belt men come forward for are common. They're not suffering in silence. This is 1 in 10 men will have erectile dysfunction, probably more than that. And your brother and your father, all of these men have experienced these kind of symptoms, and we have good ways to help with that. So, realizing that you're not alone is important, and that while it's a sensitive area, and certainly we've got to be respectful of that, it's a common problem, and we're used to helping people with this. So you don't have to suffer in silence or worry that, you're the Lone Ranger. You should come in and get evaluated. Again, it could be a symptom of something more serious than just simple sexual function. And so making that first step can really save your life down the road in other ways.
Do you find, Dr. Joseph, the machismo as a barrier? Am I the only one who's
No. I think Dr. Cookson is saying the same thing. Once you get down there, there's a fine balance between respect and personality. Because you do have to express a certain level of your own personality to make him feel comfortable.
Okay.
And at the same time, you have to respect the norms and barriers of medical legal practice. And one comment my doctor uses with me is, "You'll come back to me anyway. You can come back early, or you can come back late." So oftentimes I put it in perspective for them. You can come back when you have a polyp. That's benign. Or you can come back when you have a fungating mass you can't hide. You can come back when you have a little, dysfunction or, erectile dysfunction that only you notice. Or you can come back when everybody knows it. And sometimes men like to have this sense of comparison. The idea of exposing yourself and the machismo, the whole thing, I go through it. My urologist is 6'5", 300 pounds of pure muscle. I dread going to him. But the idea is I'd rather go early before it's worse, before it becomes metastatic or functional. So I think when you put it in context to men, that this problem is going to show.
Prostate cancer is, the most common male cancer. About every 15 minutes, a man in America dies of prostate cancer.
Wow.
If you were to sort of fill Yankee Stadium, about half of those people would be gone every year because of prostate cancer. So, I mean, you got to put it in perspective, but there's reason, and colon cancer is right there with it. So, if they want to live a good life and they want to live a long life, prevention is the way to go, and getting screening so that if you do have a problem, it's caught before it's too late is so much better than paying on the other side when it's too late, and then our treatments are really just trying to control symptoms and not really curing.
And one thing I want to add about Dr. Cookson is absolutely correct. You can't hide it. One of the problems we face in our community is the concept of family history. So it's not just a problem of the person being reluctant to go to the doctor. And you find this in many immigrant communities as well. That once a relative had colon cancer or had early prostate cancer, they don't really communicate it sometimes to the rest of the family. It becomes a sign of shame. So the other rest of the relatives that may have sought early detection, I may have sought earlier colonoscopy, earlier screening, turn not to benefit from it. So I will tell some patients who have colon cancer in their 40s and 50s, I'm sorry, you should have came earlier. I can't do nothing of this, and there's nothing good about this. We'll take care of it. There's only one good thing for sure that can come out of it. Your brother, your sister, your sons, your daughters can get screened earlier. But in many communities, that's a source of shame. That's a source of machismo as well. They don't share that conversation. So I think both what my colleague is saying, early detection, 20% of mortality, that's a lot of numbers. That's a lot of people. There's millions of people a year die from colon cancer, prostate cancer, breast, preventable diseases. And for men, say, you can deal with this. And the more support system they have, the better it is. The more support system they have, I think the better it is. So you encourage them without violating their HIPAA, the privacy concerns, to have family involved. It's a long-term process. Even the screening, as well as Dr. Cookson said, getting their wife involved, their family involved. So the family structure is very important in this as well.
Very interesting. I have recently, I'm trying to encourage people to do this, and I have recently gone and I told people, if you check a car for every 100,000 miles or every whatever mile, 40, then you should check yourself. And I've told folk that I have gone in for my 100,000 mile checkup. I want to check everything that moves, that doesn't move. If I could check a laugh, I'm going to have that check too. I'm going to start with the most distasteful or the biggest problem areas, and I'm going to work from there and work my way down to whatever. So I am really encouraging everybody. Let's really get out there. Were some of the procedures? We've got to find a new way. When are you guys going to find a new non-invasive way of doing this stuff? You guys at the cutting edge.
They're working on it. We will someday have a liquid sample or a biopsy. We're close. So right now, I mean, again, it's not everybody that comes forward needs an invasive procedure. It might just be that you get reassured that you don't need that. But of those small percent that do, finding that thing early can make all the difference. I like what you said though, and Senator Sanders, you may have a new invention. We have all these apps in our car and they tell us you're due for your oil change, you're due for this, you're due for that. We should tie that to health. Maybe that would be a great idea, because people forget, they're busy in their lives and they don't, remember, oh, it's time to go see the doctor. I don't know how to correlate that with the miles on your car. It probably depends on where you work and how you drive, but I like that concept to remind people. it's time.
No, it does. Okay, Dr. Joseph, when are you going to create something so that we could do this by the internet? We
already have it.
So why aren't you sharing it? You should have given it to me.
The first thing you should do, get advice from the guy you pay. Don't get advice from Google. Get advice from Cousin Johnny, because he will tell you all the things you don't remember. I had a colonoscopy. I came in, the guy's a good friend of mine. He started a joke. I woke up, he finished a joke. I said, when we get started, he's done. That thing we have is called sedation. 90% of people that get sedation don't even remember the process. They don't even know they had the process.
I did not know I had the process.
But our society has us so revved up beforehand that we feel like we have to make something up, that we kind of miss something. The truth of the matter is, most colonoscopies in America are done in the office. In the office, you're able to do conscious sedation, and many of those people don't even remember the process. They remember what they read in the internet and their friends. Prostate biopsies, and direct ultrasounds in the operating room, or they don't even remember it. So I think sometimes that cultural aspect of this monstrosity of this happening to that, there's some mental problem. We have the medication. So I tell most people, for colonoscopy, upper endoscopy, anoscopy, you barely remember a lot of process. It turns out, for the other things that I do, I pay a lot of attention to see when can we use the maximum amount of sedation, maximum amount of pain medication, maximum amount of local anesthesia when appropriate, so that you minimize the trauma you cause for that patient. Not so much for my procedure, but for the other procedure they're going to have from the urologist and the other specialists, because sometimes the person is not traumatized by you, but you have to deal with the consequences of the trauma of another healthcare provider. So we all have that combined responsibility. One, to convey the idea that a colonoscopy is usually 99% of the time not painful. You don't remember it. And basically, we have that elixir you're looking for. We have it. It's called Diprovan.
Well, I concede that I don't even know when I fell asleep. I remember years ago I had one, and the doctor was talking, and I think it was gas at that time, and told me to count to 10. I remember getting to 3, but I cannot tell you about 10. And this time was, I mean, I really do not remember any of it. I remember people telling me I could wake up. So I can attest, my friends, that it can be done, that you can go in there, you can do all the mental stuff you got to do to prepare yourself, get in there. And once you're in there, I was treated very well. I was treated in a very sensitive fashion. Well, y'all got to work on these gowns too. Y'all got to give us decent gowns. Why? I mean, come on now. Just work with me. Why? Well, there I go thinking again. So I was treated in a very good fashion, and I am blessed to say I had a good outcome, where I was told, because I have made a point of making sure that I don't have a bad outcome. I want to get it early.
Right. And you don't have to, fear is usually of the unknown, but if they know that they're going to come forward, it might be recommended they have a procedure. That procedure can be done in a very comfortable way, or even in an unknowing way, once with modern anesthesia, et cetera. So that's not a reason not to come forward. The other thing you touched on was the machismo and the, if you could get another point across for men's health, daily exercise,
Mm.
eating healthy, just including vegetables and just basic things like that. All of us played sports in high school. All of us, some of us played college. You gain a pound a year on average after high school, and you wear it, and it just, you need to be physically active.
Excuse me,
Bone
doctor.
health.
When does that pound stop? I mean, give me an age
Well,
now.
it stops when you intervene, and that means you come up with a plan to eat, about as much as in your fist each meal, or you exercise, for 45 minutes 5 times a week, and you pay attention to your body. You don't just let things go. But men's health isn't just the cancer things we've been talking about. It's their heart, it's their overall body, it's bone health. Men's bones weaken. If you're carrying a lot of weight, you're going to get osteoporosis. There's just a whole lot of things to keep track of. But the simplest things, as Dr. Joseph was saying, starts at home. It starts with your lifestyle, avoidance of excess, alcohol in moderation, don't smoke. Those are just basic things that we all should do. And that adds years to your life. It's preventive. Don't abuse yourself and then come in like an old Jeep and say, fix my Jeep. I mean, it's really hard to reverse things at that point.
My. I'm just reflecting on the numerous things that even I must change. I mean, I was looking at I'm very grateful I have a large hand. I mean, you
can eat a lot. There you go.
I'm very grateful for a large hand. Otherwise, was that a hand or was that a fist?
I'm going to remain silent on correlation of any of these sizes things, but
I'm talking about the food, of course.
Me too.
We're not talking about our former president's head problem. I was talking about the fist and eating no more than the size of the fist. Is that what it is?
Yeah, there's a lot of different ways that people.
Was that the meat?
Yeah, there's a lot of ways in which people, learn to eat healthier, and portions are part of that. Selection of what you eat is part of that. But I guess I'm just trying to not lose this opportunity for men's health to say that it begins with your lifestyle and it begins today, right? I mean, the journey of 1,000 miles begins with that first step, and it's not too late. It's never too late to get back in the game and to try and reverse some of those bad habits, and to exercise more and lead a healthy lifestyle. And by the way, if you have to have surgery or you're entering into a healthcare problem, the better fit you are, the better you're going to make it through that too. So now's the time.
Well, I agree with you. I have a question for you, Dr. Joseph and Dr. Cookson. I'll start with you first, Dr. Joseph. Now, we're speaking of men's health, and we're speaking of lifestyle, but many of these communities are over impacted. They are coming from the environmental injustice communities. They are things. I live right by Kennedy Airport. The jet fumes are, I have no control over that. The traffic and the noise and the things that we're finding out that have negatively impacted, I have very little control over. So, can I really make a difference with my portion control when my portion of the environment had been really wrecked? Dr. Joseph.
You can only do what you have in front of you. I think the situation you have to deal with is what you have to deal with. I'd rather have an 18-year-old perfectly healthy patient with a polyp. I'd rather have a 50-year-old skinny person to operate on. I don't have a choice. And I can't go back and tell the mother it's because they're morbidly obese or because they smoked for 40 years or for 50 years. When at that time, that patient, that's the canvas you have to deal with, plus or otherwise. Now, I do agree, Dr. Cookson, I'd love for that canvas to be better. And we all love it. Our outcomes will be better. Our wound infections will be better. Our success rates, our death rates will be better. But I can't blame the patient. So in a way, there are people that grew up in worse circumstances in the world who make something of themselves. So, for me, it's a two-edged sword. One, be the best you can be in that environment. Apply the best you can apply as you are confined to that environment. Yet never stop fighting either to leave it, as many people have, or as you are doing to improve it. It is not one or the other. I think it's a simultaneous fight. A boxer doesn't just throw a right hand and drop his left hand. He throws his right hand and keeps his left hand up. Because you're obligated. You're obligated as a physician to deal with that circumstance. So I think as a member of the community, or as a citizen, you're obligated to do the best for yourself in that environment while you're simultaneously trying to improve it. And we know how to improve it. We improve it through the economic system, through the political system, and through the educational system. That formula hasn't changed thousands of years, But regardless, you would still have to deal with it what you're given.
Well, Dr. Cookson, what good is really doing all of these things if my environment is so corrupted, so impacted? I'll be kind, impacted.
So, you're talking about like what is a modifiable factor, and it's not an excuse. Okay, I've lived all over the world, like Dr. Joseph. I was born in Scotland, lived in the Philippines. I've seen poverty, I've seen wealth, and you can change certain things about yourself, and they're not excuses not to do that. So whether you live in a high pollution area or whether you live in the woods, you're able to control how much you exercise, how much you eat, the lifestyle that you live, avoiding smoking. So I guess I'm going to say that it's pretty easy to make excuses. Yeah, I don't like what's going on around me, so I'm just going to let myself go to pieces. But I would rather take you change what you can about yourself. That's fairly easy. And then we rely on lots of things to help us change the environment around us. And that is a harder thing, right? Pollution, we know that's a problem. Noise pollution, the chemical pollution. I mean, those are things that I can't answer on this show, but it's not an excuse not to go to the doctor once a year, not an excuse not to get health screenings. And it's certainly not an excuse to, let yourself fall apart. So I'm going to say change what you can and try to help change things for the better for others too.
Well, that is what I spend much of my days doing, as you gentlemen know. And I do encourage people that especially if you find yourself in an environmental area that justice is a long way off, as we have found ourselves, that you need to, part of the health is you getting out there and changing the situation so that your children and their children won't have the negative impact that you have. That if it's a question of pollution, this is a new day and age, and we should struggle for planes to be less polluting and things of that nature. There are political things that we can do. If we find ourselves near a dump or something of that nature, there are things that you can do that will help your health, including your mental health, as we work on the situation. I agree that the change, even as you can't simply change the outside world. You may not live long enough to change the outside world, but you'll live longer at this change if you make sure that your inside world is the healthiest that it can be. And that it's a holistic. It's not a separation that, until I get this noise down outside or the airplanes, my friends, it's going to take a long time before we get every plane in Kennedy to be less polluting. I would suggest to you that that portion control may be more useful. If that is your way of going about it, then you certainly need to figure out how to live long and healthy so that we can do these things. Health, my friends, we are just about at the end of our time, and we're gonna give you your last words. You gotta, you're aiming to a guy like me. I am your last. I am reluctant. I mean, I'm vaccinated, yes, but I watched it and studied it and really was reluctant. I know the history of this stuff and was reluctant, but I absolutely got out there and want everybody to know that my friends, as Dr. Joseph can tell you, we saw the refrigerated trucks that had to be brought in because there were so many people dying that we had to bring in refrigerated trucks to deal with the overflow. But which brings us back to your health as men. Dr. Joseph, what's your last word to a guy like me who says, you know, I still don't want nobody touching me?
There are many diseases we don't see anymore. We don't see tetanus anymore. And you only have to one day hold a 10-year-old or 5-year-old in your hand that's hard like a rock, that cannot breathe, that's dying because it's suffocating. You know the effect of tetanus, the effect of measles, diphtheria. The list goes on. The amount of people it's killed. And the reason we don't see these things no more in America, typhoid, is because we have measures to deal with them, healthcare measures to deal with them, whether that be vaccinations, whether that be colonoscopies, whether that be rectal exams, PSAs, breast exams. This is the best that we have. Mm-hmm. Our life expectancy today is better than it was 50 years ago. Our quality of life in terms of per year, per age, is better than it was 50 years ago. We do not have a perfect medicine. But if we had the medicine we had today, 2 years ago, 500,000 people may still be alive. So this is still the best we have. So we're not looking for perfection. We're just looking to keep you alive a little bit longer and providing you a means to stay alive with a better quality of life. And I think that's generally the approach I would take with them, because medicine changes every day and we'll change with it. But in the meantime, every doctor, nurse, PA, and yourself interested in the healthcare profession, we are trying to do the best to make sure the quality of life of our brothers and sisters are better than it would have been.
Dr. Cookson.
Well, he said it so eloquently that I barely need to say anything at all, but I think prevention is the way, and seeing your doctor and for a routine check once a year is a standard that you should adhere to. Leading a healthy lifestyle is a standard that you should adhere to. And then back to the vaccination thing. It's unfortunate that we might be reluctant to have a vaccine only to pass on a lethal virus to someone we love and then they die. So it's a selfish thing not to get vaccinated. It's really because you don't care about the people around you, if you want to put it that way. You may think it's just a personal choice, but you're a vector for passing it along. And while being vaccinated alone doesn't prevent that, it goes a long way. So even if you personally can't see the value in it for yourself, if you have older people, frail people, people that have other medical problems and they interact in your daily life, you should get vaccinated for them. And doing something for another person is probably about as good a thing as you can do in your whole life. So that would be my take on it.
Well put, both of you. I was expressing my hesitation with my doctor, and I'm a veteran, so he spoke of how he worked with veterans and how he worked with a Marine Corps colonel, and he spoke to this colonel and said, you really need to have these tests done. And the Marine Corps colonel was hardcore and said, that he was not going to have any man anywhere near him. And he said that he heard a year or two later, 3 or 4, that the colonel had passed over something that perhaps could have been caught early. So, there's nothing macho about dying young.
There's not.
There really is nothing macho about dying young. There is something macho about not dying, if you wish, if you insist on being macho. There is something about catching things. I am of the type that I really want to catch whatever. If there is something, I want to catch it early. I want it to be treated early and things of that nature. Some people say they don't want to know. I think that's so foolish. I can't even put it in words. No, I want to know, and I want to know early. Even as we speak, someone near and dear in our community has passed, and they found out in stage 4. And that, my friends, is not a good stage to find stuff out. You really want to find out in stage 1. And I heard, is there a stage before 1? Is there a stage before that?
It's kind of prevention.
Prevention.
I'm sorry, prevention, yes, okay.
For colon cancer, you usually don't stage a polyp, a benign polyp, but if it's non-cancerous, like benign hypertrophy of the prostate, you don't really stage it. So if you do it early enough before anything happens, there's nothing to stage. It's a benign disease. But oftentimes we don't stage benign disease if it's a simple polyp. So the idea is before even stage 1.
Wow.
But the screening that saves lives is those patients that are detected before symptoms, before those pains and aches manifest. And we have tools to do that, from the screening for colon cancer, the screening for prostate cancer. Prostate cancer is a blood test, and that can save your life. So, if you're so macho you can't have a blood test, I'm not sure you're very macho.
Well, that is true. If you're so insecure about that, you're really not macho. A secure person is going to be who they are before, during, and after. Forget macho. If you're secure, you'll be who you are before, during, and after. So we perhaps need to, all of us, put away macho and just go for secure. Just go for who we are. Why don't we just be healthy and happy at that? So my friends, I really appreciate you 2 doctors taking time. That is one impressive library in back of you, sir. As a bibliophile, I was looking with envy upon all those books. And Dr. Joseph, don't worry, I was looking at your background too.
I like the background.
Trying to figure it and trying to figure what do all these mean. It looked very Hindu, I must admit, in the background. Is that Hinduism, sir?
It has some appeals to Hinduism, but there is a traditional Haitian spirit, like a traditional Haitian spirit that has these 2 markings. And I was very surprised how the African deity that we call Dantor in Haiti has been very similar to an American Indian deity, an Indian from India that they call Pinga. Again, showing that the universality of manhood was beyond our mere religious and perspective, that when we have disease, everybody dies from the same disease.
Yes.
Everybody dies from the same complications. They're a lot rarer and fewer race and difference between men than we thought in the past. So this picture, like I said, transcends American Indians, India, Hinduism, Haitian, African, Udun tradition. And so that's the reason I liked it, because it shows the universality of man. And in medicine, that's important to also always recognize. And COVID-19 has taught us this, that none of us are immune in this new world order. None of us.
Well, I love both of these these symbols that we have in back of us and the symbols in back of me, all of these are symbols and things that we're trying, the greater good that we're trying to all get to, including the question of health. Health is one of the greatest goods that you can have, because if you don't have that, you don't have, I mean, nothing else has the same significance. Nothing else will matter the same. So having said those things, again, I want to thank you both for being with me in this time, and forgive me for my tardiness. We just had an election up here, and elections have consequences, and we were trying to figure out, am I on first, second, third, the home run, or did I strike out? It's so hard to know. That will affect my health more ways than one. But I really appreciate you gentlemen spending time with me as we try to see these things through. And again, my name is Senator James Sanders Jr., and I thank you for being with us as we struggle for clarity on the question of health, men's health in particular, on the show called Let's Be Clear with James Sanders Jr. Thank you very much, and thank you both for being here.